My area of research, I think, began with my background working with adults who have cancer, and when I moved to pediatrics and neurosurgery, I found that it was really challenging to nurse these patients because I didn't have a really good sense of what their symptom experience was and how symptoms were impacting on their quality of life. Through my research, I identified that this population, who on average were off treatment for 4 years, still had a fairly significant symptom burden, on average 6 symptoms each. So that really raised the awareness of the importance of us understanding the magnitude that symptoms can have on children's quality of life, and allowed us to help focus our strategies and our interventions to making sure that as nurses we're assessing these symptoms on a daily basis when we see these kids in clinic. The most common symptom was energy problems and fatigue. One mom that came to my door one day that really drove things home for me. This was a mom of a 16-year-old girl who'd been in our care a couple of years and off treatment, and mom was really frustrated with the fact that her daughter was still having so many problems with energy conservation. So I was able to pull up a slide and show her the data from the study that indicated that over 50% of the kids that I interviewed were having problems with energy. So all of a sudden, Mom was able to sort of put things in context and normalize her daughter's situation, and it was really therapeutic for her. It's been a really enjoyable journey, going from developing the question through to being able to answer some of the questions that I set out to answer. And it certainly gives me motivation to continue to do the same kind of work with the same population or other populations of children.